PhysioPilot is a portable device that measures and displays joint kinematics for clinicians. Here's a compact case with handle and wheels. In the first layer are the camera on the left, the laptop on the right, with the trackers in the middle, along with plates used to attach the trackers and the pointer for landmark registration. Below are the connecting cables. Both the camera and laptop have separate batteries. The bottom layer holds a tripod and elastic straps, and the camera is easily assembled on the tripod with the laptop placed on a small table 2 meters away from the examination table. This is the first screen where clinicians enter their name and department, patient's demographics, date of birth, etc., and the side being examined. The next screen records the camera position with respect to the patient's leg. Here it is contralateral. The patient is supine with both lower limbs exposed. The first strap is placed and held around the thigh, a few centimeters above the patella, with the plate facing the VMO tendon. The second strap is placed a few centimeters below the tibial tuberosity, with the plate facing the medial tibial surface. The blue tracker is attached to the tibial plate, and the red tracker to the femoral plate. The yellow tracker is attached to the pointer assembly. Registration starts with landmark registration through an automatic recording of the medial epicondyle, the lateral epicondyle, and the middle of the knee. The surgeon then registers the medial malleolus, the lateral malleolus, and finally the middle of the ankle, concluding the landmark registration. Next is the kinematic registration, starting with the centre of the hip recording in an L-shape movement, and finally the knee kinematic centre is recorded through flexion extension and also external and internal rotation of the knee. The registration is now complete. The screen displays in real time each movement of the knee in varus and valgus on the vertical axis and in flexion extension in the horizontal axis. The yellow dots are recorded during flexion and the blue dots are recorded in extension, displaying the natural knee laxity envelope. The knee can then be stressed in varus and valgus. close to 0 degrees, 15 degrees and 30 degrees, demonstrating the range of laxity in the knee. The Lachman test can also be performed assessing the state of the anterior cruciate ligament. It is also possible to assess the isokinetic dynamic knee flexion, which is important for both sports doctors and sports physicians and scientists. In addition to monopodal and bipodal alignments, it is possible to evaluate the dynamic knee valgus.